course, the results from the finger trial that we were able to show after 2 years that there are clear benefits on cognition, all important cognitive subdomains. So this is not only preventing cognitive decline or dementia, this is really optimizing brain health, so it's important for all of us. We have been able to see benefits for many other outcomes as well. Lower risk for functional decline, reduced risk for stroke, clear health economic benefits as well. And actually one of the very exciting findings was that the risk of multimorbidity was reduced by 60%. So we have the benefits for the brain health, general health, on individual and on societal level. The question has been, what are the underlying mechanisms underlying this multi-domain intervention? And we don't know yet all the answers. We think that there are vascular related mechanisms, inflammation. We are studying a lot biology of aging related mechanisms. And we have been able to see that finger intervention can counteract the shortening of the telomeres. So these are some of the underlying mechanisms. The second important question is, can we find some responders? Because we know that not all people are getting the same response for the intervention. And one of the candidates we were able to find was BDNF. We know that's important for the synaptogenesis, for the brain plasticity, and importantly, it was the proBDNF. The access or the serum levels of that at baseline that seem to predict the gain of the finger intervention for memory and especially for the complex memory. So it kind of indicates that BDNF and proBDNF has something to do with the molecular mechanisms for the memory gain. I think that's very exciting.
As someone who's obviously had such a big hand in the prevention side of things, what are sort of the key points you feel as though are to prevention of Alzheimer's disease? Obviously there are some of the more notable things that we've talked about before, but is there anything that you can point to that maybe isn't emphasized enough or we should be continuing to try to work towards a little bit more?
I think there is still so much we need to focus on prevention, because the list of modifiable risk factors has been getting longer and longer. I believe it's not yet the final list we are having. There are novel risk factors we are studying, or at least more new risk factors like hopelessness, loneliness, these psychosocial risk factors which have been getting very common, especially after the pandemic. Stress, sleep disturbances, oral health, and so on. So we should study more some of the new risk factors to understand more how big impact they are having.